The views expressed in this program do not necessarily reflect those of this station.
Welcome to Insights into Northeast Michigan, a WBKB News public affairs program. Insights deals with the issues affecting those in the community as well as Northeast Michigan and the state. And now, Insights into Northeast Michigan.
Welcome to this week's Insights, and thank you for joining us. I'm Asia Suber, and today we have Carly Huffman, who is the Homeless Veterans Program Coordinator. And today she is going to be talking with us all about homeless veterans in the community of Alpena. How are you doing today, Carly?
I'm good, Asia. How are you?
I'm doing good, and we are so excited to have you here.
Thanks for having me.
No problem. So tell us a little bit about what you do at your job and the program.
Sure. The Saginaw VA, we cover 35 counties total in our catchment area, anywhere from the thumb all the way up to the bridge. And our homeless program has a few components. The first one is primarily doing a lot of outreach. So we are partnering with the community, kind of walking the streets, looking at places where homeless veterans may be. We also have one transitional housing program up in the Gaylord area. So that's an up to 2-year stay for our veterans that are homeless, and they get a lot of case management and other services to kind of identify barriers to their homelessness and overcoming those. We also have contracts with several shelters throughout the catchment area so that veterans who need emergency homeless shelter are able to go there, which is covered by the VA. And then the final program we have is the HUD-VASH program, and that is where we partner with local public housing authorities. They provide a Section 8 voucher to the veteran in part of the rental subsidy, and then the VA provides the case management services.
Okay, so pretty much spread out around the counties of Alpena.
Absolutely, yes.
Okay, and with some of these homeless veterans, what are you seeing? Are you seeing older and younger veterans? Is it more males, females? What are you seeing?
On average, a lot of our veterans are over the age of about 53, but we do have quite a few of the returning veterans from the current era that are coming back homeless. A lot of them are males, which is pretty specific to just the culture of the military in general, but we do have a few female veterans that come into the program as well. Most of them do have some type of mental health or substance abuse disorder that they're battling, which has impacted their homelessness quite significantly.
Wow. What other programs within your program do you offer? So is housing, is there counseling and things like that to help with that?
Absolutely. So we operate on a housing first model, which essentially means if we don't have housing, if we don't have a roof over our head, it's very difficult to work on some of these other issues. So our primary concern initially is getting either them shelter or some type of more stable housing. Then we definitely connect them with services at the clinics locally. So that would be mental health, substance abuse. If they have medical needs that they're not having addressed, we connect them with those. Our program also offers employment services. So we have vocational rehabilitation counselors that work one-on-one with veterans to help them find jobs in the community to get a stable income.
And what kind of jobs are you setting veterans up with?
It depends, really. One of the biggest issues we have is whatever the veteran was doing in the military, that doesn't always transfer over to civilian life. So a lot of times what we're doing is partnering with some of our vocational programs that provide like stipends to go back to school, trade schools. We try to get them involved with those types of programs to get the skills they need for civilian workforce. But we're also connecting them a lot with like factory type jobs or even just general retail, working in food service, just something to get them back into the work environment to get used to that.
And before they go out into the civilian world, how long do veterans stay in your program?
It all depends. The HUD-VASH program is actually indefinite. So as long as they meet eligibility requirements and income limits, they can stay in the program forever. We do graduate them from case management services if they have a job and they're meeting all of their goals and they're able to function independently in the community, but they're still able to keep that voucher. Some of them are in a shelter for a matter of a month before they're able to find an apartment and move out. Same with transitional housing. Even though it's up to 2 years, it just kind of depends on their motivation level and how hard they work on their own goals, and then they're able to transition pretty quickly.
And you speak about eligibility. What are the requirements to get into the program?
For the HUD-VASH program, they're all set by HUD. So those are the guidelines that we have to go by. Essentially, for a one-person household, the income limit's around $1,600 a month, and then they're required to pay 30% of their income. For the HUD-VASH program, they also need some type of case management service. So they have to have some goals identified or some barriers to why they're not able to maintain housing on their own. And then otherwise, that's pretty much what we look at.
And have you seen veterans with families? Are families coming with them, or is it just single veterans?
Mostly single veterans, but we do have families that come through. We've had a few just husband and wife. We have a few with kids. We've had a few single moms with children come through. Primarily single men, but the families are sometimes our biggest challenge because the resources around just aren't available to accommodate a family as much as it is a single person.
And so I guess my biggest question is, maybe the viewers at home want to know the same thing. Why are veterans coming home homeless? Isn't there benefits that they get for serving?
There definitely are. We also assist the veterans with applying for any type of benefits through the Veterans Administration that they're eligible for. So if they're coming home with some type of service-connected injury, we try to get them connected with that type of income. And also, like I had said, just whatever they're doing in the military, what their job is in the military, doesn't always transition to civilian life. So a lot of times they come home and they aren't able to get a job that pays enough to be able to sustain it on their own. One of the biggest things we see is a pride issue. You know, they come home and they definitely don't want to ask for help. They're wanting to do things completely on their own. So being able to connect them with someone at the VA that maybe they can relate to, one of our veteran staff, definitely works out. But again, just the mental health and substance use issues that they come home with, it's more getting them into treatment to get them to make some type of progress with those symptoms before they're ready to settle down and be able to maintain their home.
Yeah, and so the ones that do come home, are they home permanently, or do you send some of them, do they go back?
Most of ours that we work with are permanently home. They have to be eligible for VA care for our program, so that usually means that they have served their time in the military, they've been discharged honorably from the military, and they're home permanently.
Great talk. We're going to continue this conversation when we come back. Stay with us. Welcome back to today's Insights. If you are just now joining us, I'm here with Carly Hoffman. She is the Homeless Veterans Program Coordinator in Saginaw. And previously, we have been talking about the program that she works for and what she does. So thank you for being here today.
Of course.
What is your program doing to prevent veterans from being homeless when they come home?
The biggest thing that we try to do is partner with the communities. Up here in Alpena, this area, I will say the community involvement is huge, and we couldn't say thanks enough to so many different programs that have helped. But it's really a collaborative effort in preventing homelessness of veterans and addressing those veterans that are homeless when we do identify them. So we work very closely with Continuums of Care, so that's the collaborative group in the community of different agencies that help with homelessness, and what we can do with policies, what we can do with resources. Several agencies have different federal grants, and they use those funds, whether it's to develop a shelter, develop apartment buildings, rent to veterans, or just give them some type of rental assistance if they get a few months behind on their rent or if they need a down payment. So we're really looking at those types of things, as well as just as a community, what can we do to better identify these individuals and identify areas that they can go when they're in need so that they don't have their homelessness situation get worse.
And now within your program, can, let's say, residents, is there any type of fundraising or donations that you all take up?
Yes, so through the VA we are not able to ask for donations specifically, but a lot of times we do attend community events. So they do like homeless veteran stand-downs, Project Connects, just general veteran benefits fairs. So we do attend those, and a lot of times individuals just bring in donations, and it's not necessarily the VA that needs the donations, it's more the community agencies that we partner with, because a lot of times we don't have the money necessarily to help veterans, so we are reaching out directly to have somebody write them a check for that security deposit, or give them a check to pay off their back rent until they can get back on their feet, things like that. So while we do provide a lot of the case management services, it's really reaching out to the community for those types of donations and that assistance that the VA in their position is not able to provide.
And even with going forward, what are some new things that you're wanting to bring to the program?
We definitely are trying to expand our outreach and getting involved with any community partners, whether it's an individual or an agency who is wanting to help or work with our homeless veterans. Definitely reach out and connect with anybody throughout the VA, and they can kind of point you in the right direction, whether it's me or our case manager stationed in each of the counties and the regions that we serve. We definitely have a staff right here in Alpena at our outpatient clinic here, but we have program staff throughout our catchment area that are able to assist. So definitely we really want people just to call and ask questions, whether it's wondering what they can do to help or events that we're having. If they want to host an event, we're more than welcome to, participate in those. We love being at those just to get the word out about what we can do.
What is the community currently doing to help the homeless veterans?
Not too long ago, nationally, they came out with the Coordinated Entry Directive. So what that means is the VA and the continuums of care partner together to kind of have one access point for all of the veterans that gets them access to any service that is available to them. So we meet regularly as that continuum of care, and then we also prioritize the veterans based on, are they recently returning? Do they have children? Do they have a disability? And we prioritize them into the correct service, the best service that will meet their needs. We provide case management, we provide that financial assistance that they need. Any type of service, we kind of collaborate to see what we can do. And then we also have what's called a by name list, and that's regularly we review all of the veterans that are identified as homeless within a community. And that's when it goes back to how do we prioritize these veterans and get them the services that they need as fast as we can.
Even in previous years, have the numbers went down previous, or have they went up? What are you seeing?
They've definitely gone down. I believe the percentage is significant since 2015. Annually, we do a point in time count in each community to literally count the homeless individuals at that moment. And we've seen those numbers go down over the past few years, and also looking at just the by name list numbers that I talked about. We went from 4 down to 0 throughout the quarters. So our goal is ultimately to be able to say that we have effectively ended homelessness in each community. And what that means is the number of individuals who we've previously identified as homeless, there's more of those now in stable housing than the number of literally homeless individuals currently.
Wow, that is really awesome to see that what you all are doing is working. And so, is there any advice that you want to give to any homeless veterans out there and how they can contact you all or, get involved in this program?
Absolutely. For homeless veterans, I would just say just to reach out, whether it's to a community agency, whether it's to me at the VA. We also have a national call center for homeless veterans that they can call, and that will just put them in touch with somebody that they can talk to. We really try to take the approach of where is the veteran at and what do they need in that moment. We definitely don't try to push them into an environment that's going to be uncomfortable for them. It's definitely just reaching out and asking questions and being aware of what assistance is out there. I can't tell you how many times I connect with a veteran and they are just shocked at what type of services we offer that they had no clue about.
Okay, and my last question is, are you seeing more homeless veterans in one county than the other?
Yes and no. Up in this region, it's pretty general across the board. No one community has more than the other. But again, I think that it just shows the numbers are lower up here just because of the community collaboration. Down in more like Saginaw, where I'm from, the bigger cities, obviously the numbers are a little bit greater just because of the population density. But up here, I can't stress enough how the community has come together to make sure that these veterans don't stay homeless.
Wow, that is really good. And we thank you for stopping by and having this conversation with us. In our next segment, we're going to have another guest come on, so stay with us. Welcome back, and here we have John Sangolis. He is the Veteran Housing Resource Specialist for our homeless veterans in the community. How are you doing today, John?
Good, thank you. How are you?
I'm doing good, so thank you for joining us today. Can you tell us a little bit about your program?
Yes, I work for, it's called Supportive Services for Veteran Families. It's short, it's SSVF for short. The acronym is SSVF. It is a federal grant through the Veterans Administration. So we get federal VA money to administer the homeless veteran program in this region of northern Michigan.
And how many regions do you serve?
I currently serve veterans in a 5-county area. I handle Alpena County, Alcona County, Presque County, Iosco County, and Montmorency County.
And I know that you work with the housing. How do you get housing for these veterans?
Well, it's really it's a combined effort between myself, NEMSCA, or I should say my organization. I work closely with NEMSCA. I work closely with the VA here in town in Alpena, and the VA down in Iosco County. And I work with the homeless shelters, the Sunrise Mission here in town, and I work with the Emmanuel Mission in Iosco County. And basically, I have, like I said, it's a federal grant. I have money through the VA. So if a veteran is literally homeless, I have money to pay their security deposit, and then I have money for monthly rental to help them with their monthly rent. So it's a short-term program. The most that they can get is 9 months rent. And it's kind of like a helping hand to get them started. I'll get them into a place and get them situated. I'll work with different charities in the area to get them maybe, couch, bedding, the items that they need, the necessities, and then get them into a place.
And what are some of the requirements that the veterans might have to have? Is there, do you have to have been employed sometime, or is there anything that they need before you just put them in the house?
Well, the qualifications are, number one, that they're what they call literally homeless, which they have, nowhere to live. They're either at the shelter, living on a street, living in a car. And as long as they're a veteran, and it really doesn't even matter the length of service, as long as they're a veteran that was discharged or I shouldn't even say honorably, as long as they were a veteran that was not discharged dishonorably, I usually can help them veterans find some sort of suitable housing for them.
And are these veterans, are they staying the full 9 terms, or are they able to find jobs and find work and able to move before 9 months?
Well, the 9 months is that's the max the program pays. So if I get a veteran and I'll work with Michigan Works to get them maybe employment, but once they're self-sufficient, and sometimes I will exit a client before they have the full 9 months. If they get to the point where they're self-sufficient, then I will exit them from the program. But yeah, I work with the different agencies from Michigan Works and different employment agencies to try to find them jobs. Or if they're disabled, I connect them maybe with, say, DHHS or some other organization to help them get benefits that maybe Social Security or something else that they can live on and help them, sustain themselves. So it's either if they're capable of working, we help them try to find jobs. If they're not capable, we'll tie them into different benefits that may be able to help sustain, their living expenses.
And I know when we were speaking to Carly earlier, she was talking about different community events. Do you participate in anything community-wise, donations, fundraising?
Absolutely. I work with all the different veteran groups in the area. We had a veteran fair in Iosco County last month, And we're having another one up in Sheboygan County on September 26th, next month up in Sheboygan. We are always doing different veteran different veteran affairs, we have, different coffees in different counties, and just try to get tied in. Each county has a veteran service officer, and your veterans should know that as well, that every county has a veteran service officer, and those veterans can go to that veteran service officer. They're employed by the county. They're usually located in the county buildings, and I work closely with the we call them VSOs, Veteran Service Officer. We work closely with them just so we're all tied in to all the different resources, all the different programs, and whether they're specifically veteran programs, whether they're, maybe it's community mental health, maybe it's DHHS, maybe it's working with the local nonprofits, or a lot of faith-based organizations step up and help us as well.
And in the future, what are you all doing to add more to the program? Is there any additions or maybe plans that you're thinking about doing?
Well, because the program is from the VA, I have limited, I have to follow the program guidelines that are from the VA. So, we try to think of creative ways that we can house veterans in our area. Like one way we're looking at is possibly trying to do roommates, where it might make it more affordable. If I can find two veterans that are compatible, and I could put them into a house or apartment together where they could, share the costs after I'm done assisting them, which might further their ability to succeed, So we look at, certain different things, but the program is through the VA, and I got to work within those program guidelines.
And lastly, before we wrap everything up, how can people get in touch with you and your program?
If there is a veteran in need, I would ask them to call NEMSCA's homeless intake line. NEMSCA is our, they're the ones that they do the initial intake, and then they'll get the veteran information to me. And NEMSCA's intake line is 989-358-4678. Again, 989-358-4678. Any veteran could call that number. You usually have to leave a message and with their name and phone number, and then someone from NEMSCA will call them back. They'll do a screening with them, and then NEMSCA will get in touch with me. But they can also go through any county veteran service officer. They contact me through the different shelters in the area, the Sunrise Mission, the Emmanuel Mission. So there's different ways to get a hold of me. The primary way would be NEMSCA, but again, any veteran organization in this 5-county area knows who I am, and they'll get a hold of me.
Thank you, John, for that information for today. If you are a homeless veteran and you need help, the NEMSCA number is the number to call. That does it for today's Insights. Join us back here next week.
Insights into Northeast Michigan is produced by WBKB News. If you have any comments, suggestions, or topics you would like to see on a future show, please email WBKB News. This has been a production of Thunder Bay Broadcasting Corporation. All rights reserved.